Hi everyone, I hope you can hear me and I hope you're doing fine. I'm so sorry that I wasn't able to give you the class virtually today. A lot of problems with the internet, but I wanted to record this video so we can be on the same page about today's topic. So today's topic is billing, medical insurance, and insurance card payment. So for the objectives, the students will define the term medical insurance, the students will identify the medical billing process in English, the students will understand the use of the insurance payment card. So for the introduction, medical billing is not like other types of billing, collecting appropriate medical reimbursement while managing health plans, payer types, and healthcare regulations necessitates the use of highly trained professionals, physicians, and providers. Groups rely on experienced medical billers since their financial health is only as good as their billing team. Okay, so this medical billing stuff is actually not easy. It's not something that anybody can do. You have to be trained. You have to be certified. I really don't know if you need to have a license, but I do believe that maybe you do. It's very important, and right now is one of the greatest battles being fought. The thing of medical plans, medical insurance, and the denials, the approvals, and all this stuff. It really, our lives are depending on it, and it's becoming a battle, really. So being a good, medical being a professional is really absolutely obligatory. If you're going to follow this career, you really need to take it seriously, to understand that it's a legal stuff, um, and of course it's very important, and your job is definitely valued. Okay, so let's start with some glossary of medical billing terms to understand this world of medical billing. So co-insurance is the percentage of money that you are expected to pay after the deductible is reached. So it's that money that you pay after the insurance has paid for their part. You know, Copay is the flat fee that you're expected to pay for a medical service, such as a doctor's appointment. So, okay, the copay is what you pay when you're visiting the doctor's appointment, and sometimes you also need to have a copay in some kind of service, the dentist or stuff like that. Deductible, it depends on your insurance. Deductible is the amount of money that an individual pays before the benefits of health insurance kick in and co-insurance starts. Okay, health insurance is a system that organizes people, institutions, and resources to deliver health care services. Medicaid is the health insurance for a very low income people, okay, funded by federal and state government. So it's the health insurance for people that do not have the resources to pay for a private medical insurance. Okay, Medicare is a federal health insurance program for people over 65. Okay, most of the time is a benefit that people get when they get also the Social Security. Network, the groups of healthcare providers, laboratories, pharmacies, etc., that are connected to a specific health insurance company. For example, in the in the first medical insurance plan, there is a clinic, which is actually a clinic that works 24 hours, and you can also go there and have your laboratories tests made. You can also go and have different types of exams like CT scans, MRIs, and since it's part of your part of your health insurance, you don't have to pay anything because you are already paying for those services through the payment that you give to the medical insurance. Uh, and there are many clinics like that going on nowadays specifically. So out-of-pocket limit. After you have paid this amount of money, your health insurance will cover 100% of your costs for medical services that are included in your plan. Okay? Premium, the amount of money that you and or your employer pays the insurance company every month or year as part of the insurance plan. Okay? Healthcare systems and health insurance. What is a healthcare system? Okay, a healthcare system organizes people and resources to provide medical care to a community or population. Different countries have different healthcare systems. Healthcare in the United States, okay, in the United States, the combination of commercial corporations and government public organizations. Insurance and healthcare can be confusing and difficult to understand. Healthcare in the United States is controlled by numerous entities that are not linked to one another. This is why if you visit a new clinic or hospital, you may be required to fill out new information forms. This can also make healthcare decisions a little bit difficult, okay? It's kind of a little bit difficult procedure because there's a lot of money involved and nobody wants to lose it. So what is health insurance? Insurance is something that you get so that if you become ill, if you get sick, you will not have to pay all of your medical expenditures on your own, okay? An ill or injured individual who has health insurance can have her insurance company pay for some of her medical treatments, okay? Without health insurance, a person must pay for all his or her own medical care, which can be costly, okay? Because health services are expensive. Preventive health treatment is also supported by health insurance. Often, health insurance companies will pay for yearly checkups to assist prevent people from becoming very ill. And I do believe in that. I do believe in having prevention programs, because prevention, as the word says it, prevents you from getting sick, prevents you from then having to go and spend more into treating an illness that could have been prevented, that could have been stopped from the beginning. And I do believe that this is the best way to go, preventing. Okay, what is the procedure for obtaining a health insurance? A health insurance is similar to a communal jar of funds for medical bills. Everyone contributes to the jar. Some folks may become ill and require more money from this jar than others. Others may not become ill and so will not require the funds. If everyone contributes to the jar, there will be enough money for everyone if they become sick or ill. Okay? How can I get health insurance? There are many ways that you can get health insurance. Okay? If you're employed, many people receive health insurance through their workplace. Okay? Their employers will pay and give you medical insurance as a benefit. All right? Unemployed, disabled, or low income individuals may be able to get insurance through a program funded by the state and or the federal government, like Medicaid, all right? And like what is Tu Salud, I believe it's called right now. I don't remember, but it was called Tu Salud, Mi Salud, La Reforma. It has had many names here in Puerto Rico. There is, public health insurance, and if you don't have the funds to pay for health insurance, you will benefit from the government's health insurance. Employed but uninsured individuals whose job do not offer insurance can purchase private insurance. Okay, so you will have the money from your job because the job do not offer you the medical insurance, but you can pay for it, privately. Okay. And if you're age 65 or plus, the senior citizens who have lived and worked in the United States or its territories for a certain amount of time qualify for Medicare, a health insurance for senior citizens provided by the federal government. Okay, but this is for the United States citizens and its territories. Okay. So as a territory of the United States, Puerto Rico gets that benefit. So I need you to please answer these in your notebooks and send it to me. You can answer it in Word, or you can send me a message if you want through Moodle, or you can answer it through the email, whatever is easier for you. But please answer these questions. What kind of healthcare system does the United States have? We already answered that. How can you get health insurance if you don't have a job? We already answered that. And there's also a critical thinking skill question that you need to answer with your partner. So in this case, you need to grab your partner, communicate with them and answer this question. Write a brief paragraph of 5 sentences to answer the question. Why is having health insurance important? Why is it important? Okay, a paragraph of 5 sentences to answer that question. So how you and your insurer share costs. This is an example, okay? So for example, January 1st, beginning coverage period, and this is for Jane. Jane's plan deductible is $1,500. The co-insurance is 20%, and the out-of-pocket limit is $5,000. Okay, December 31st is the end of coverage period. So Jane hasn't reached her $1,500 deductible yet. Her plan doesn't pay any of the costs. So for her office visits, she has to pay $125. Jane pays $125, and her plan pays $0. Okay, right now she has to pay 100%, and her plan pays $0 because she hasn't reached her $1,500 deductible yet. Okay, so more costs, like in medication, hospitals, doctor's appointments. Now Jane pays 20%. Okay, her plan now will pay 80%. Okay, because she has reached her $1,500 deductible. Okay, so now her co-insurance begins. Okay, Jane has seen a doctor several times and paid $1,500 in total. Her plan pays some of the costs for her next visit. Okay, office cost is $75. So now Jane will pay 20% of that $75, which is $15. Her plan pays 80% of those $75 is $60. Okay, so right now she has coverage, in this period, because she has already reached her $1,500 deductible. Okay, so now more costs. She will keep on paying for medication, pharmacy, hospital, doctor's office. Okay, so right now Jane reaches her $5,000 out-of-pocket limit. All right, Jane has seen the doctor often and paid $5,000 in total. Okay, her plan pays the full cost of her coverage health care services for the rest of the year. Office cost now is $200. Jane pays $0, and her plan will pay $200. So her plan now will pay the 100%. It's kind of the opposite of what happened before, in the beginning. So this is what happens, and this is an example of how you and your insurer share costs. Of course, this depends on every plan, every type of plan, every type of insurance is different. This is only an example, all right? So use the chart above, the chart that we already discussed, okay, to answer the questions. How much is Jane's deductible? What percentage of the bill does Jane's healthcare plan pay once co-insurance begins? What percentage of the bill does Jane pay once co-insurance begins? How much is Jane's out-of-pocket limit? How much does Jane pay after she reaches her out-of-pocket limit? All right, all of those questions are answered, and you can see Jane down there. No, that's a picture, general picture. That's not Jane. All right, so you will answer those questions with the chart that we have already discussed. Okay, and please, just like the first exercise, answer it through the email, in a Word document, through a Moodle message, however it is easier for you but please answer it. All right, so now we have a conversation, and you know that I always have to include a conversation because this is conversational English. So please record yourself practicing this conversation. Please, I ask you, please record yourself practicing this conversation and also send it to me through the email, through Moodle, or well, those are actually the two ways, because I can download it through WhatsApp. So please, through Moodle or through the email. All right. If you need help on how to do it, just write to me, reach me, and I will help you. So it's a conversation between Mario, who has been hired at a technological business, and he's meeting with their human resources director to talk about health insurance. Okay, so she's explaining, the director of HR is explaining the different health benefits options to Mario. So HR is the human resources director, and Mario is the employer. Okay, so record yourself making this presentation. So these are also some questions to please answer based on all the information that we have shared so far. What kind of healthcare system does the United States have? A, B, C, or D. What is copay? A, B, C, or D. What is deductible? A, B, C, D. What is medical insurance? A, B, C, D. And Medicare is A, B, C, D. All right, so you can write the number and the letter that you chose. So here's a video of medical insurance conversation. Please watch it. Here's another video, great, excellent video about what is medical billing. Please watch it. So I also included a PDF document about the insurance payment card. Please study it and read it. So the 10 steps in the medical billing process: patient registration. The initial stage in every medical billing flowchart is patient registration. This is the collecting of patients' demographic and basic information such as name, birthday, and the purpose for the visit. Medical billers collect and verify insurance and information such as the name of the insurance provider and the patient's policy number. This data is used to create a patient's file that will be accessed during the medical billing process. Okay, so financial responsibility, the next stage is to ascertain who is financially responsible for the visit. This entails reviewing the patient's insurance information to see whether procedures and services are covered during the visit. If procedures or services are not covered, the patient is informed that they will be financially responsible for those charges. All right. No one is denied medical attention, but you have to understand that after you receive those services, you will have to pay for them if your insurance doesn't pay. The super bill creation: during check-in, the patient will be asked to fill out paperwork for their file. If this is a return appointment, to confirm or update information already on file. All right. Identification as well as a valid insurance card will be required, and co-payments will be collected. A medical coder converts medical information from the visit into diagnosis and procedure codes once the patient has checked out. Okay, so this is what the ICD-9 or 10 is used. All right. Then to protect, so the ICD, I believe we're already in the 10th, is used to protect the patient's information. So instead of writing the illness or the sickness, so that information can remain confidential, what we do, what they do is that they write a code. All right, and that code is knowledgeable, for doctors and everyone involved in medical services. All right, but not for anybody else. And then, using all the information obtained thus far, a report known as super bill can be created. It will include information about the provider and clinician, the patient's demographic and medical history, information about the procedures and services done, and the applicable diagnosis and procedures codes. The claim generation. Okay, the super bill will then be used by the medical biller to produce a medical claim to be submitted to the patient's insurance company. Once the claim is prepared, the biller must carefully review it to ensure that it fulfills payer and HIPAA compliance criteria. including medical coding and formal requirements. Okay, this is the most important part because you know you have to generate a claim so that you will be paid for the medical services. All right. Claim submissions. The next step is to submit the claim after it has been validated for correctness and compliance. Most claims are electronically transferred to a clearinghouse, okay, to a clearinghouse, which is a third-party firm that serves as a mediator between healthcare providers and health insurance, okay? High volume payers such as Medicaid are an exception to this norm and will accept claims directly from healthcare providers. All right. So Medicaid is, you know, is exempted of this norm. All right. Exempt. I'm sorry. Exempt. So monitor claim adjudication. Adjudication is the process through which payers examine medical claims to determine if they are valid and compliant, and if so, the amount of reimbursement that will be paid to the provider. The claim may be approved, rejected, or refused during this process. A claim that is accepted will be reimbursed in accordance with the insurance arrangements with the provider. A rejected claim contains errors, okay, that must be rectified before the claim can be resubmitted. A refused claim is one that the payer declines or really doesn't want to pay because it has mistakes. All right. Patient's statement preparation once or mistakes or missing information. All right. It can have mistakes or it can be incomplete, or it can be you know not justified by the medical insurance. You know, they have most of the time medical insurance have you know, guidelines of reasons why claims will be or could be declined. All right. Patient statement preparation. Once the claim has been processed, the patient is billed for any outstanding charges. The statement generally includes a detailed list of procedures and services provided, their costs, the amount paid by the insurance, and the amount due from the patient. All right. And the final step is follow-up. The final step in the medical billing process is to ensure that all bills are paid. Medical billers must contact patients whose invoices are past due, and if required, refer accounts to any collection agencies. All right. So this is all for this presentation. If you have any doubts or questions, remember to reach out for me. It's really an exciting topic. It's really amazing. Everyone will be dealing with medical insurance, with medical billings, with having to pay any medical bill at least once in their life. This is a common matter. So even if you are not a professional medical biller, you definitely need to understand these terms to be able to handle your health bills in an effective way. Okay, so thank you very much and good night.